The Hmong are a group of people native to East and Southeast Asia. Many have been forced to become refugees due to war, oppression, and religious persecution. Beginning in the 1970s, many Hmong families flocked to the city of Merced, California, to follow an influential community leader who had resettled there. The city eventually became a central hub for members of the Hmong diaspora living in California and other states. The Spirit Catches You and You Fall Down is a non-fiction book by Anne Fadiman, which documents the tragic story of Leah Lee, a young Hmong girl with severe epilepsy, and the failure of the mainstream medical community in Merced to effectively treat her. The book provides a prime example of how not to engage with and intervene in multicultural communities. Leah Lee had her first seizure when she was just 3 months old. Her parents brought her to the Merced Community Medical Center for treatment, but were unable to communicate with medical staff as they did not speak English and the hospital did not have Hmong interpreters. The hospital ultimately sent Leah and her family home without a correct diagnosis, as she was not actively seizing at the time she arrived at the hospital. The following 4 years consisted of a series of similarly dysfunctional interactions between medical professionals and the Lee family. The Lees, like many Hmong people, viewed their daughter's problem as spiritual in nature and attempted to treat her using traditional Hmong remedies. At one point, Leah was placed in foster care due to her parents' non-compliance with mainstream treatment regimens. The Child Protective Services worker assigned to their case ended up befriending the family and was the first and only person to ask the Lees what they believed was causing Leah's illness. Ultimately, Leah became brain dead and later died due to the inability of the medical system to reconcile with the Lees' cultural needs and perspectives. In stark contrast to Leah Lee's story is the story of the Bon Vinay Performance Company. Dwight Conquergood was assigned to act as a consultant in the Bon Vinay refugee camp by the International Rescue Committee's Environmental Health and Education Program. The camp, located in Thailand, was home to approximately 47,000 Hmong refugees. Many Westerners who worked with the Hmong refugees in the camp described them as, quote, difficult to work with, stubborn, and backward, and blamed the Hmong for the poor conditions in the community, rather than the structural and systemic realities that necessitated the camp's existence and current state. As an ethnographer, Conquergood believed that the best way to learn about another culture was by immersing himself in and observing the community he was working with. Conquergood engaged with the community by personally utilizing the services of their traditional healers for gastrointestinal problems and foot injuries he experienced, while also educating them about some of the benefits of Western medicine. In this way, he encouraged the adoption of a both-and model of healthcare, in which the two cultural perspectives and practices could work with rather than against one another. After establishing rapport with the community, Conquergood helped assemble a group of youth to form the Bon Vinay Performance Company. Their mission was to use the medium of skits, parades, and other forms of performance art to communicate critical health messages to residents of the camp. After a failed attempt by the IRC to have the camp's dogs brought to a central location to receive a rabies vaccination, the performance company decided to put on a rabies parade to raise awareness about the problem and get the camp residents' buy-in. Drawing from Hmong folklore and mythology, the company created elaborate costumes and marched through the streets of the camp, providing information and instructions about the vaccine initiative through a bullhorn. The parade was a huge success, and the following day, almost 500 dogs were vaccinated. The company solicited feedback from Hmong elders about the cultural appropriateness of the parade after this and other performances, and adjusted their program based on their input. The company also developed a performance to educate the International Rescue Committee personnel about Hmong culture and spirituality, and included a local shaman conducting a blessing ceremony for staff who volunteered. Dwight Conquergood stated, "I hoped to break the pattern of importing the knowledge of, quote, experts and distributing it to the refugees, who were expected to be grateful consumers. I wanted to help demonstrate to both expatriates and refugees that dialogical exchange between the two cultures, the two worldviews and sensibilities was possible." A similarly successful organization was developed in Merced after the publication of A Spirit Catches You and You Fall Down. The multidisciplinary approach to cross-cultural health coalition, known as MATCH, was formed in 1996 and was initially comprised of volunteers from the Hmong and healthcare communities. In 2003, the organization became a nonprofit. Its Partners in Healing program provides quarterly 40-hour trainings which bring together Hmong shamans and medical professionals so that they can gain understanding and respect for one another's beliefs and practices and collaborate in order to improve health outcomes for their communities. Healthy House also engages in advocacy to ensure community systems are culturally appropriate. Thanks to their efforts, Merced Mercy Medical, the renamed hospital where Leah Lee was once treated, now has a policy formally allowing shamans to perform 9 specific healing ceremonies within their walls.